As the world marks World Health Day, the World Health Organization is calling for global efforts to combat diabetes. Globally, 420 million adults are living with the disease, a quarter of them Chinese. The WHO says the trend of increase in China has been explosive. But how to stem the rise and what we should do to protect ourselves? Our reporter Wu Guoxiu hears some advice from a doctor and a nutritionist.
Beat diabetes. The World Health Organization is calling for action to halt the global rise in diabetes and an alarmingly increase in China. The WHO says 10% of adults in China now suffer from diabetes, but back in the 1980s, it was less than 5%. The majority of diabetes sufferers have the type 2 diabetes, largely the result of excess body weight and physical inactivity. Unhealthy lifestyles are also putting China's children at risk.
We see from clinics that obviously more children below 14 are getting type 2 diabetes. Besides hereditary factors, the main reason is they've been overweight since when they were growing up.
Diabetes is incurable, but if managed well, especially if detected early, major consequences like kidney failure, heart attacks, and even blindness can be avoided. The Chinese government is working to raise the public's awareness of the disease. But in the end, the best course of action is a correct and healthy diet, advice that's backed up by one of China's most popular nutritionists.
Eating no sweet food doesn't mean you don't get diabetes, because according to glycemic response, we find white bread increases your blood sugar faster than white sugar. So eat oats and grains without oil and sugar for breakfast. Eat enough protein and especially more green leaf vegetables before you eat rice.
The World Health Organization says beating diabetes requires a social solution. Individually, all of us can do more to reduce our own risk by eating more healthily and getting more exercise. Governments at all levels and the broader community also have a role to play to make healthy choices easier for everyone. Wu Guoxiu, CCTV, Beijing.